Hello, my name is Laura Ettlin. I am the Mansfield Foundation Fellow, and this past summer I spent 3 months in the Twin Cities working at Twin City Orthopedics in physical therapy. Twin City Orthopedics is a large outpatient orthopedic setting, and they have served Minnesota residents for over 60 years. If you go there, you would see anything from general practitioners to surgeons, physical therapists, occupational therapists, and other medical professionals as well. I had the privilege of working with the physical therapists and their department, and they would treat everything from a joint sprain to a joint replacement, as well as bone fractures and nerve injuries as well. My responsibilities during my fellowship included a lot of sanitation and organizational duties. I would walk patients to their rooms and make sure that the cabinets were stocked with proper materials for each session, equipment or towels and pillowcases as well. I would be sure to sanitize the rooms before and after each patient, and I would also be in charge of doing laundry and organizing and sanitizing the gym equipment as well. Here are 2 pictures that depict 2 of the things that I was in charge of. The top picture is a look into some of the cabinets that include a lot of items for rehab at home in particular. So they have some TheraBands and shoulder pulleys, as well as compression socks and other items as well. The bottom picture shows 2 devices that were used a lot throughout knee replacement patients a lot. And one of them is a Game Ready, which is a cold compression, and the other one is ultrasound. Both of these devices work on swelling and inflammation. Now to the fun stuff. During my fellowship, I was able to work alongside physical therapists, and particularly I was looking at the rehabilitation process after a knee replacement. So I had 3 main goals. The first one was to look at the rehab process days after surgery all the way to the time of discharge. So this included everything in between beginning to end, and also session to session, month by month. Throughout each session, we looked at different objective measurements such as range of motion, flexibility, strength, as well as some biomechanical analysis to chart patients' process along the way. And lastly, I gained an overall understanding for not only what exercises we're going to do, but how these exercises are relevant and how they're going to help progress a patient through the rehab process. During my fellowship, I was able to speak with surgeons and talk to them about which bones, muscles, ligaments were involved in the knee replacement process, as well as see some of the prosthetics that are used to create the artificial knee. Again, I talked with physical therapists about patient goals and how we might tailor patients' rehab procedure towards accomplishing their goals, whether it be they want to get back to water skiing or hiking or just walking around the block to walk their dog. I was able to talk with patients and gain some patient contact hours, and again learned a lot about the devices and exercises that were used in the rehab process. Here are 2 very commonly used devices. One is called the flexinator and the other is the extensinator. They're used to work on straightening and flexing the knee, mostly working on range of motion and flexibility, and these are 2 very key components of the rehab process. I learned a lot intellectually and professionally throughout my fellowship. Intellectually, I learned what it means to go through the rehab protocol, so what types of exercises are used. Since I was following patients and physical therapists from morning to evening, I learned what a full day as a physical therapist was like, looking at everything from patient documenting to criteria that must be met for evaluations and discharge for patients. And really gained an overall understanding for what it means to be a physical therapist and working with other medical professionals as well. Professionally, I learned a lot of networking. Since I'm in the process of applying to graduate school, it was very beneficial for me to meet with graduate students as well as physical therapists and talk to them about their education and what I might look for in my education in the future. And lastly, since Twin City Orthopedics is not only an orthopedics setting, but they also work a lot with sports injuries and sports rehabilitation, I was able to see these 2 realms of physical therapy and something that I might want to do in the future with my physical therapy degree. conclude, I wanted to send out thank you to the Mansfield Foundation for funding this great opportunity and experience. I wanted to thank Twin City Orthopedics, especially my site mentor, Chris Bailey, in addition to Steve DeVries, the kinesiology department here, as my faculty advisor. And I also wanted to thank the Career Engagement Center for everything that they have contributed to this experience. Thank you.